Since the wars ended in two of those countries, Sierra Leone and Liberia, this approach was not taken, right? Investments in health and well-being were not at the forefront. It was the growth of GDP. And by those measurements, actually Sierra Leone and Liberia are way up near the top in rate of GDP growth. But right down near the bottom, if you compare them, as I will, to Rwanda. Now, I was lucky enough to get to know Mike first, not at our university, a small community-based college in Cambridge, Massachusetts, but in Rwanda. And I knew he was giving a seminar on competition. And I was out at a rural hospital, and I said, I can't wait to see Mike Porter, because I'm going to tell him, you know, you should see the great collaboration between TB, tuberculosis, HIV, and even parasites like malaria. So I'm going to spool up my video on the way that those bugs collaborated against us while we were competing with each other in development and healthcare. I'm kidding, I don't have that video. But I think it would be a great video because the inside social progressives, instead of collaboration, there was competition where it wasn't warranted, right? Public health is full of it. Prevention versus care. Eric Gooseby, I hope we'll talk about this later on. I could go right down the list. Cancer versus safe motherhood. These are insane kinds of discussions that are the result of those silos that you talked about. Now in Rwanda, after the genocide, which as you know was in 1994, think about it. I wish I did have some way of showing this progress visually and compellingly. In 1995, it is likely that Rwanda was the poorest country on the face of the earth. By any index that we would use, any metric in my field, meaning medicine and public health fields, maternal mortality, infant mortality, juvenile mortality, camp epidemics, not just of TB and HIV, but cholera, typhoid. Rwanda was at the bottom of the heap. Now, that's 20 years ago. That's not a long time. And what happened after that is going to be disputed. Again, claims of causality should be disputed. But I'll give you the short version that I believe, and that is that progressive social policies led to a fairly substantial, and by local standards, meaning by the GDP of the country, massive investments in the development of a health care delivery platform, and also important investments in health and education. Now, how was this done? And I'm sure you all read our piece in the British Medical Journal last year. I mean, no one would ever miss that. Or the Lancet, that one was on the anniversary of the genocide. No one missed that, right? We even have downwardly mobile medical journal names in medicine. The Lancet. It's old and it's British. What can I say? So basically, the programs were to have an equity focus from the beginning, right? And what does that mean? That means girls, women, rural areas, and the poorest quintile, as we've been taught to say by economists. Preferentially served. This is what the liberation theologians call a preferential option for the poor. Now, that wasn't the language of the Rwandan policymakers, but was fine with us. I say us because Ophelia Dahl is here, as some of you heard her last night. So what we got to see in the last 11 years working in rural Rwanda was a transformation. In fact, these are probably the steepest drops in mortality ever recorded anywhere, any place in human history. Now, how could that happen in Rwanda? So, now, to close, I feel like applauding every time I look at the data, and trust me, it's pretty boringly presented the way I do it. Eduardo, can you do a little seminar with me afterwards? But these are indisputable developments. The claims of causality will be made by many. And I've said that an investment, look at the fraction of the public budget of Rwanda that went into healthcare and compare that with India. Compare that with Sierra Leone, Liberia, Guinea, any place you want. This is the largest investment in healthcare delivery, not the fights between prevention and care that hobbled our world for so long. And it was intentional. It was a policy. Now, understanding how to study the feedback loops that would allow us to improve policies and economic policies, I think, is a critical challenge for everyone in this room. I mean, some of the claims of causality that are made are absurd, right? Some of them are historically uninformed, most of them, in fact, right? And some of them just don't understand what's happening to our world. Some of these claims reflect ignorance. For example, everyone should know about the massive worldwide declines in infant and child mortality, because now we're going to get stuck, right? If maternal mortality drops from the levels that Rwanda saw 20 years ago and gets stuck somewhere, you want to know why. And the answer is, this requires more investment in health care for safe mother at that level of those who would have complications. If infant mortality gets stuck at 30 per 1,000 live births, why? Again, it requires more investment, more difficult. Being born at home isn't safe for neither mother nor child, et cetera, and I won't go into all the examples. I will say that Liberia and Sierra Leone, as I said, and I'm looking forward to learning more about Guinea, that's not what happened after 2002. Investments were not made in these sectors in the same way, in the health sector particularly, but also in education. So the SPI is a welcome development because it would give us something, again, a benchmark. And I'd like to mention here, in closing, announce, in fact, that this lack of higher education, in my line of work, each of us has gone through multiple years and years. I mean, I have an MD and a PhD, right? I know my mother laughed when I said that too. So, and here we are doing the equivalent of prevention versus care in education. We're saying, oh, for Africa, primary education only, right? No wonder there is umbrage taken. Right? We've all gone through that process, and then to dismiss the talent, the human resources that there are in places like Rwanda or Sierra Leone and Liberia or across the world. People want higher education. So I'm announcing, thanks to some private donors and partners in the Rwandan Ministry of Health particularly, but also education, the establishment of the Rwandan University for Global Health Equity as of today. And thank you for those of you who supported this effort and others. We will not pay attention when people say you don't need universities in rural Rwanda or urban Rwanda. You don't need advanced degrees. You don't need people like Mike Porter from Rwanda. That's false, and I hope to see a lot more of genuinely egalitarian development using this tool. Thank you very much.